Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of pharmacology with the topic autonomic pharmacology, and we'll be focusing on atropine specifically. So let's start.
Welcome to the examination. Let's begin with atropine. Can you describe its mechanism of action?
Mechanism of action of atropine is that it's an antimuscarinic. It blocks muscarinic acetylcholine receptors M1 to M5 on smooth muscle, cardiac muscle, and gland cells. It has vagolytic action. It blocks the effects of vagal stimulation on the heart, resulting in increased heart rate, tachycardia, and competitive inhibition. It does not prevent the release of acetylcholine but competes with it, preventing acetylcholine from binding to the receptors. Am I correct?
That's a very comprehensive answer. Now, could you tell me some of the primary clinical uses of atropine, particularly related to its effects on the heart or secretions?
Yes, it is the first line therapy for hemodynamically
Yes,
unstable
your answer.
bradycardia, causing increased heart rate. It is the antidote for nerve agents or insecticides that cause cholinergic crisis. It is a pre-anesthetic, inhibits salivary and respiratory secretions to minimize the risk of laryngospasm. In ophthalmology, it is used as a cycloplegic and mydriatic uses. Spastic GI conditions are inhibited, like IBS.
Excellent. You've covered key applications very well. Given its effects on the heart and secretions, what would be some contraindications or situations where you'd be cautious using atropine?
Uh, the
While it's commonly used,
The contraindications would be tachycardia, palpitations, arrhythmias, mydriasis, dry mouth, etc. It can increase intraocular pressure.
you've mentioned some key side effects like tachycardia and increased intraocular pressure. Can you think of specific medical conditions apart from certain arrhythmias where its use would be dangerous or strictly avoided?
In case of closed angle glaucoma, obstructive gastrointestinal diseases like pyloric stenosis, paralytic ileus, obstructive uropathy, and severe ulcerative colitis, we will not use atropine.
Precisely. Those are the critical contraindications. Moving on, what would be the signs and symptoms of atropine poisoning and how might you manage it?
Signs and symptoms of atropine poisoning are
Yes, you were about to list them. Think about the extreme effects of receptor blockade. What would you observe?
in that case, we will observe hot as a hair, blind as a
Yes, that's
bat,
good
dry as a
point to
bone,
remember.
red as a
So,
beet, and
besides
mad as a
hypothermia,
hatter.
what other manifestations would be present? And how is this typically treated?
Treatment for poisoning is cardiovascular monitoring, and specific antidote like physostigmine is used, and we will sedate using benzodiazepines.
That's completely correct. Physostigmine is used because it can cross the blood-brain barrier. You've covered the essential aspects of atropine. Is there any other drug you'd like to discuss within this topic?
No, thank you.
Very well. That concludes this part of the examination. You can exit the session.